Initial setup. The goal is to align the lower extremity so that the knee is directly centered over the center of the foot. Owens's research showed that this is the most stable alignment for both normal and pathological gait. The easiest way to manipulate this alignment is utilizing removable heel lifts that can be placed in the shoe. You can add up to 3/4 of an inch in the DRAFO without problems. Anything more than that you should add to the outside of the shoe. It is recommended that you take the patient's shoe, fit the DRAFO to the shoe, and align the DRAFO prior to fitting your patients with the shoe. This puts you in the ballpark of where you need to be when you actually fit your patient. Standing assessment. Once you have the shoe lift adjusted to align the knee over the center of the foot, it is important to assess your patient in a standing position. What you're looking for is that the knee is centered over the center of the foot and the weight line is centered over that as well. What you should notice is your patient will have a much more stable standing balance. If they are leaning too far forward or back, you need to adjust the lift to accommodate for their balance. There are going to be some variations to the posting mechanism. The key to remember is that you always want to align the center of the knee to the center of the foot. If a person has a dorsiflexion contracture, you may need to apply a negative heel to their shoe to accomplish this. DRAFO fitting and fine-tuning. It's very important before you fit your patient, you take your patient's shoe, fit the DRAFO to the shoe. What you want to do is look at this alignment of the shoe and the brace to the floor. You're looking at adjusting the shank angle. Remember, this dorsiflexion plantar flexion angle was fixed. What you're going to want to do is set the brace so your shank angle is typically 5 to 7 degrees of dorsiflexion to the floor. Once you have figured out the appropriate lift for your shoe, the next thing is to don the orthosis. Slip it on your patient. Check your trim lines. You want to get the heel nice and seated. The nice thing about the DRAFO is you can actually see through the plastic to make sure your patient is seated. Fasten the Velcro. And in the case of our patient, we're using a lift, and I like the adjustable, removable tear-apart lift so you can fine-tune as you ambulate your patient. We will start there. It is important to note that we put this size of lift in our patient's left shoe. It is important that we balance the leg and put the same size lift on the other side, just slipping it in the heel. Again, the adjust the lift style lift is the most appropriate because one of the things that will occur as you align your patient, they will change and you will need to change the alignment typically of those lifts, either raising or lowering, depending on the ambulation process that occurs. For the fine-tuning process, ambulate your patient. Look for a posterior catch or any hesitation as you see here in the gait cycle. This indicates your lift is not high enough to accommodate for the position of the ankle. Increase the lift and look for the smooth translation. We have now added the appropriate lift to balance the brace to the floor. As you can see, the tibia now migrates smoothly from heel strike to toe off. As your patient gets accustomed to this orthosis, the cadence and velocity of their gait will increase. There is the possibility you may need to increase that lift. Also, by getting the smooth translation of gait, you are able to achieve a stretch on the gastrocs proximal to distal with the terminal extension at heel strike and the extension at toe off.